Hello and welcome back to the Advancing Healthcare Innovation Show. I'm your host, Michael Stamatinos. And if you're new to us, super excited to have you here because you know what? We're bringing really exciting conversations from leaders that are painstakingly shaping the future of healthcare. And we're really passionate around healthcare innovation adoption, leadership, and access. And if it's your first time tuning in, let me just sort of take a quick step back and tell you a little bit about what we're trying to do here. So we are a healthcare innovation company, and we're focused on bringing stories of innovation within our space to life. And it's really about highlighting real people that are in the trenches within our space, getting stuff done, and just giving them a platform to be able to showcase their stories with the world. And we've got an incredibly action-packed year. If you haven't checked out any of our historical stuff, make sure you hit the subscribe button now so that any new conversations come right to your inbox. And as part of our commitment to keep you updated with the latest and greatest that's out there, we are honored today to welcome a very respected leader within our space, Dr. Lyle Berkowitz. Dr. Berkowitz is currently the founder and CEO of KeyCare, a distinguished virtual care company that's exclusively built on the Epic platform. And his background spans from primary care physician to healthcare executive, an informaticist, an innovator, an entrepreneur, and his past roles include founder and chairman of HealthVenture, and he also served as chief medical officer at MD Live, and he also led innovation efforts for Northwestern Medicine in Chicago. And presently, Dr. Berkowitz is the editor-in-chief for Telehealth and Medicine Today and serves on the board for OneView Healthcare. So Dr. Berkowitz's exemplary contributions and constant pursuit of better, more innovative healthcare solutions haven't gone unnoticed. And among other laurels, he's been featured on HealthSpotter's Future Health Top 100, Health Leaders list of 20 people who make healthcare better, and Modern Healthcare's Top 25 Clinical Informaticists. So we're thrilled to have you with us, Dr. Berkowitz. Welcome to the show.
Thanks, Mike. Hearing all that sounds like I can't keep a job, but I do like a little variety. But I'm happy to share what I can.
You know, you've done a bunch within your career, and if you were to kind of take a look back at all these different tours of duty that you've done, and fast forward into today, what do you think about all those different tours of duties has really allowed you to flourish from what it appears to be and what you're doing at KeyCare?
Well, I'll answer in a couple of ways. I mean, one, there's been a consistency to it all, and a collaborative nature. Meaning, I've done a lot of these things at the same time. I practiced primary care medicine at Northwestern, for 20 plus years. At the same time, I was a system executive, so I split my time between seeing patients and being part of the executive team, focusing for a decade on IT and informatics, rolling out EMRs, next decade on innovation, digital health, etc. At the same time, on top of that, nights and weekends, I did entrepreneurial stuff. Again, all of it, though, very consistent. It's not like I was separately opening up an ice cream store. Everything I did as a doctor fed into what I want to do as an executive, fed into how I might work in the entrepreneurial environment. So there's a lot of Venn diagram overlapping of all of that stuff. And clearly, I like to do a lot of things. I'm an engineer by background, and the common theme amongst everything I did was almost always is how do we, I call it my SAD philosophy, to make doctors happy and patients healthy. How do we simplify, automate, and delegate routine, repeatable care? As an engineer, it drove me nuts in healthcare, how often we just sort of do the same thing over and over again. And my HealthVenture, one of my companies, was all about how do we automate routine refill processes. The refills for a lot of primary care doctors is 30 minutes a day. And so I knew it was a problem in my practice. I looked as an executive for what was out there. I wound up creating a company to do it. It all fed into each other to get me where I wanted. And with all that said, most of the time I just didn't know the word no. I just kept moving forward. I believe that, the universe conspires, and it just sort of helped me keep moving forward in the way that it felt right to me.
Amazing. So let's dig in a little bit about the acronym SAD and how that kind of really, is that really your true north in terms of what you're trying to accomplish with KeyCare. Talk about how that kind of
So I
just weaves
expanded
into
that
what you're doing at
to how do
KeyCare.
we save the health system? I said we need to get sad and fat. So sad is sort of a driving philosophy, and then
Yeah,
fat is is how do we do it? Right. The sad is sort of the big picture, sort of the strategy, the tactics are financial alignment, F, analytics and AI, teamwork and telehealth. Those things line up, and everything in KeyCare that I'm doing is built on my 25 years of experience doing everything else, which is how do we my driving passion is improve the healthcare system. The purpose of KeyCare is how to expand access to everyone for healthcare, because I think that's one of the biggest problems we have. We
yes,
know is that not everyone has access. As they say, we often look and say, hey, we don't have the best healthcare in the United States. We don't have the best outcomes. But the truth is, many of us would say, we have the best healthcare. It's not evenly distributed. So how do you get access to everyone? And so our vision is to build the best virtual care organization in the nation. But our mission is is to build a tech empowered virtual care teams that can amplify the providers in health systems, amplify and support healthcare systems. So all that, every word in there is really important. We can't just create
right.
teams or even virtual care teams. We have to tech empower them. We have to use
That's
automation,
right.
etc. Delegation is to the team. We virtualize that because that's an asset light way to do it in a cheaper way. And we do it in coordination with health systems, not in competition with them. All those things
Mm,
become really important about who we are, and it's who I am. I'm a health system guy, 20 plus years at Northwestern. I know technology and telehealth really deeply. I know Epic really deeply, both as a user and an implementer, as well as building tools over the years that integrated and worked with Epic, and knowing that, hey, and believing in the idea that it is
yeah.
the operating system for most of healthcare. And I've learned through lots of arrows and cuts that's easier to innovate from within, on the system that people are using versus externally trying to force your way in. And there's nothing wrong with that. That's what we do with Microsoft and Apple and so many other things. And
Yeah.
I think we have to acknowledge at some point that Epic is this great platform operating system. It's not perfect. No tech out there is perfect, but it serves as a platform for us to really deliver care in a much more consistent way.
Was it difficult as you were deciding what to build KeyCare on, knowing that your history has been with Epic? Was that a difficult choice? And do you feel like there's some folks that you're leaving out, or you're thinking out about it from like an 80-20 perspective?
It's so there wasn't a choice. We didn't say, "Oh, let's build this," and who should we work with? It was, I'm either doing this with Epic or I'm not doing it. It didn't make
Yeah,
sense.
yeah,
No other EMR system has the capabilities to do what we needed to do, and of course, none have the market share, right? So one is it didn't make sense to work with anyone else. We're going to work with the market leader. They are in 60+% of health systems. 75% of Americans have records in Epic. Working on anyone else didn't make sense. So it's the, not quite, but 80-20 rule. And so I'm quite happy working with on that system. And Epic is the only EMR that really allows for the robust interoperability between our instance and every other instance out there. They've created both data interoperability via Care Everywhere, which is their functionality
right.
that allows for data sharing between any two Epic sites. So any person goes to any Epic site and their data will be available. They've also created workflow interoperability tools that are even more distinct than any other EMRs, meaning you can do cross-instance scheduling within the data Epic framework that and functionality that Epic's created. And they specifically created something called Telehealth Anywhere, which allows
Mm,
for patients to request on-demand telehealth visits in a host health system and have access to the providers on our instance in a super seamless way. as well as being able to do scheduling across instances. And then there are a variety of ways to do cross-instance messaging, orders, referrals, etc., that just make it very easy for us to support our health system partners.
And do you feel like that's been a primary reason for sort of I'll just call it unprecedented growth that you and the team have been seeing? It seems as though that there was a point where it was like every other week, it's like we're working with this logo, this logo, this logo. And having been in digital health for quite some time, that is not easy. So without going into the secret sauce, what do you think has led to this? It just seems like there's less friction for you all. And is it a component of being embedded within the Epic environment that just makes it so easy for people to turn something like this on? Like, unpack that a
So
little bit.
yeah, I've done it before, where I, like HealthFinks and others, where I built up a tool and then I had to integrate it into the systems. And you got to get the health system to buy off on everything from the technology work it takes, the security and compliance reviews and all of this stuff. It's a long cycle and difficult and painful. And I vowed I'm never going to sell the health systems again. I'm never going to sell tech again. And in fact, we don't do that. We don't sell any new technology to health systems. We don't sell tech to health systems. They don't have to create an interface with KeyCare. KeyCare doesn't sit on top of Epic. KeyCare, we have our own instance of Epic. So we put our providers, virtualists, on our instance of Epic, and we use Epic's built-in interoperability to connect to other Epic systems. So they are not clients that are buying technology. They are partners who are partnering with us, who are essentially getting access to economies of scale virtualists that we build up, and those virtualists are working on our instance of Epic, which is optimized for virtual care. Right? Most health systems aren't optimizing their Epic instance for virtual care.
Right.
We don't have to worry about office space and printers and all this stuff. We focus all our time and attention on making Epic work in a virtual care world. And so we believe that we can do that in a way that's more optimized for our doctors, and we can bring this economy of scale to providers. So yeah, the cool thing is, once they make the decision, the technical work is certainly well under 100 hours. Most complete it in a week or two. There's operational and content things they have to do, but the truth is, we've taken away the whole issue of technical interfaces and interoperability concerns. We've also taken away the issues of security and compliance. We're all on Epic. We're hosted by Epic. So it's the same security and compliance issues they have with using Epic themselves. And all of a sudden, we've made it super easy. The yes button is just one push, and we can get going. And we solve a need they have, which is they have access issues. We have supply of virtualists, and we can expand their capacity, which is always good for a health system.
So when you're talking about virtual care, what are the types of things that typically patients are referred to you and the team of virtualists for? Can you maybe kind of talk through sort of the levels of care?
So we'll talk two buckets: primary care type of stuff and specialty care. But primary care, I always say, is like a three or legged stool, or maybe a four-legged chair. One, urgent care, overflow stuff, easy peasy. That's the first thing that we usually start with. 24/7, 50 state, on-demand access. Anytime patient calls, has an immediate issue, be able to tell them, health system, tell them, hey, we're going to connect you with someone who's going to take care of you right away. Patients love it. We have NPS scores, over 70, 80, et cetera. Patients love it. And most health systems have to turn away patients every day. Second is what we'll call preventive care. As a primary care doc, that's part of what we do. And that includes things like annual wellness visits and care gap closures, et cetera. But that is something we've actually developed a whole product line, a whole solution around annual wellness visits for Medicare Advantage and similar patients, particularly ACO patients, where the health system can say, look, we've got a lot of patients who need their wellness visits. Our doctors don't have time to do that. They're seeing a bunch of really sick people. We'll start doing that. And so now we're load balancing, and we're taking a type of patient who isn't the best use of your doctors in the office to see them in the office, and we're able to do that virtually. The third thing is what some would call chronic care, but remote patient monitoring. It might be we can break it into chronic care management, remote patient monitoring, and managing and maybe med management of stable chronic care disease, right? And then there's the pre and post-op type of care that can get done, pre-op prep, post-op follow-up, etc. So those are type of things that we're doing. All of those things I consider co-management, or covering the overflow and out of state type stuff, co-managing the day-to-day care. And in some cases, some health systems have said, hey, we want you to completely cover and provide primary care services. We can do all of that in that spectrum. And so that's the primary care stuff that we do. In the specialty area, we're signing up specialty groups to work on our platform, and that includes behavioral health, rheumatology, both are live. We're talking to a variety of other medical specialties as well that range from cardiology to neurology to maternal fetal medicine, to dietitians and pharmacists, etc. So as we get them onto our system, we turn around. The specialists in particular can do two things. Number one, they can help work down a wait list. So you have a 3-month wait list to see your rheumatologist. Boom, we'll have someone see them, triage them, either do the initial diagnostic workup and start treatment, or do the initial workup and triage them if they have a more severe issue into the office. The other thing they can do is they can work with stable patients who maybe are coming in every 3 or 6 months and say, hey, instead of coming into the office to see your specialist, if you're otherwise stable, see the online specialist. So now the office-based doctor has more room. That's a load balancing to start seeing patients in the office. Might be those newer, more complex patients. So we expand coverage and we load balance, and either way, it's improving capacity.
And how do you find it now that you're building your team of virtualists? Presumably they're all in different areas of the country. How do you kind of continue to keep a good, consistent culture? With clinical practice guidelines, people practice differently. It's just when things are decentralized in a way, how do you kind of keep things all connected together?
So everyone's remote, so there's ways to connect everyone, and we're really trying to build a true practice. And our group, KeyCare Medical Group, is focused on that primary urgent type of care, primary care, urgent care, etc. And part of what we do is try and find the right people and create the right culture. But also, let's face it, what we need to do is build our technology to make it easy to do the right thing, hard to do the wrong thing. And the good news, so to speak, is what we're focused on as a company is the lower part of the pyramid, the more what I call the triple R threat that often overwhelms doctors: routine, repeatable, rules-based care. RRR. I got lots of acronyms. Doctors love our
acronyms. A lot of acronyms. This is great.
So our focus is, how do we take this stuff that is routine and commoditized and do it really efficiently? It's going to be our doctors. We'll have NPs, nurses, pharmacists, etc. We'll build teams. We'll automate as much of that as possible, because that is the stuff that can and should be done as efficiently as possible. And we'll look for red flags. We'll rule out folks who need higher levels of care and direct them appropriately. Our goal is not to take care of the most complex patients. It's to make sure those patients are again seen in the office by the officeologist, as we'll call them, who are going to need to spend more time and do more for those patients in the office. We're trying to say, look, in a typical population, the upper part of the pyramid, the top 5% of the pyramid, drives the majority of costs and the majority, by the way, of revenue in a health system. The lower third of the pyramid, that's that routine care, it's low value stuff. Health systems will often lose money taking care of those patients, but they're the loss leader because they're the top of the funnel that creates that eventual downstream revenue. It's important we take care of them. and we make sure that they don't rise up. But that's the type of stuff we'll be doing at scale. And the truth is, I've said before, I believe we've over democratized healthcare. A 25-year-old with a sinus infection gets the same exact appointment as an 85-year-old with, you know, hypertension, diabetes, cancer, heart disease, and they both get these 15-minute appointments with the doctor. That doesn't make sense. That young, relatively healthy person, that should be done online. That's a commodity. That's a routine issue.
Right.
The older, complex patient, they deserve 30, 45 plus minutes with a doctor who really knows them and knows everything about them and can put everything together. And so our job is to be the teammate to that primary care doc in the trenches and help them manage their population, so that they can actually take care of more patients overall with our team, but actually see less patients in the office because they're seeing the ones who really are needed. So imagine if we could tell doctors, we're going to increase your revenue because we're going to pay you based on panel size and management, but
Right.
you're going to decrease the amount of work you do in the office because you're going to focus on a smaller group who really needs you. We're going to solve this whole physician crisis and physician shortage issue, and access issue all at the same time.
So talk about how you view the physician shortage crisis and how you really sort of put a different twist on it. Can you
I
maybe
do have my spin. I
illustrate that
often
a
will
little?
have said we don't have a shortage of physicians. We have a shortage of using them efficiently. It's like saying we have a shortage of travel agents because if we made everybody go to travel agents to do all of their care, we would absolutely have a shortage of travel agents. But what have we done?
Right.
We've automated and delegated a ton of that. So it's a lot of self management. And do you ever use a travel agent? Sure. If you're going to do a trip to a unfamiliar country and you want to be grand, you're going to use that travel agent. If you go to a bank, right? We don't have a shortage of vice presidents of a bank, but we would if they had to do every transaction for us. But what did they do? They created teams. They've got tellers, and then they created ATMs, and then everything's done online. And yet in healthcare, we make you see the VP of healthcare, a doctor, the highest person in that chain, every time you need anything. You want to refill, you need, to check in on any little thing, you've got to run it through the doctors. That has got to change. That is just uh, there's nothing that will cure that. Making more doctors doesn't cure a bad system, and we have a system that is not optimized yet. I'm an engineer by background, Michael. So I'm always looking for how do we re-engineer things, and we have to
Yeah.
transform healthcare, and we transform healthcare by using teams and automation, by rethinking how we compensate doctors, and by getting everyone comfortable with the fact that, again, you don't need to see the doctor for every piece of healthcare, but you do want to make sure that doctor is overseeing the team that you're working with.
How far into the future are you peering when you're doing your visioning and you're looking out? How far do you look out? And what's it like for someone on your team to be working with you, to be hearing that, and then to kind of take that into an execution mode?
So that's a great question, right? I can only imagine what it's like to be working with me, but in general, I do try and create this vision, right? That starts with how do we automate, delegate, virtualize as much routine care as possible. So we every month the team gets together. We're a remote company, but we have our monthly meetings, and we go over our purpose, vision, and mission. We talk about this sort of vision and in everything that we do. And then there's short-term stuff that I say it's going to be harder. We're going to have to sort of manually do stuff until we automate something. But
Yeah.
our long-term vision is going to be how do we, scale up? And I say right now we're just getting our health systems lined up. And by the way, you're going to
Yeah.
see a lot of new press releases coming out soon. Like we sort of
It's good
got through the
stuff.
winter season, but we have a lot of things going on over the next few months. But we have to scale. The only way we really succeed, like we're an okay company. If all we do is do virtual care online and see 4 patients an hour, we're an okay company. But for us to really succeed and transform the health system, we've got to figure out how to scale. We've got to figure out how to be more efficient, and effective at the same time. We've got to use AI, automation, et cetera, on top of our virtual care platform to do that. So everyone on my team hears it all the time. But I get, so what we do is we have metrics, KPIs, that look at everything from our volumes, and quality and satisfaction to our economics, but also to our efficiency. We're like, how long does each doctor take in taking care of something, and how much does it cost to do every little thing? So we are starting to measure, and improve on these metrics that range from, volume to quality to efficiency to economics. This is everything I've ever learned at Northwestern is, in the health system guy, is, you can't improve something until you measure it. So we are big on metrics. We do a lot of analytics, that comes, from Epic, comes from patients, et cetera. And we're, that helps drive, what we're doing and why we're doing it and how we want to improve.
Amazing. Tell the audience a little bit about where they can follow your work, the work of KeyCare, and we'll wrap up there.
Yeah, so I don't have a TikTok. Unfortunately, my kids want me to have one, but I don't. So the good old-fashioned place is you go to our website, it's www.keycare.org. It's .org. We're an organization, keycare.org. And there's a news section where you can see all of our press releases, podcasts, etc. You can follow us on LinkedIn. We love LinkedIn. I personally post on LinkedIn. You can follow KeyCare on LinkedIn. You can follow Dr. Lyle on LinkedIn. I have my website, drlyle.com, but that's sort of my general past history. The way to follow my thinking, I post almost every day on LinkedIn, and I reflect on what's going on in healthcare and telehealth, business, etc. So feel free to find me and connect with me on LinkedIn. You can probably type Dr. Lyle, DRLYLE, and LinkedIn and find me pretty easily, as well as KeyCare.
Dr. Berkowitz, it's been really awesome to have you come on. I'm going to leave you with a quote, and I think you know who wrote this. It's just a reminder, life is 10% what happens to you and 90% how you react to it. The only thing you can change is your attitude. I know some days are going to be tough, but being grateful every day about any part of that day is a much better way of going through life than you would ever imagine. So that was you, Dr. Berkowitz, and a nice piece of wisdom. And if whoever has been listening to this, if you found this conversation to be helpful for you, would you mind sharing it, liking it, commenting on it, and maybe even add in a few new acronyms if you want in the comment section. We certainly heard some really good ones today. So thanks again, Dr. Berkowitz, and look forward to our next conversation.
Sounds good. Thanks, Michael. And clearly that quote was inspired by a lot of other great folks who said the same thing. I'll end with one more. One of my favorites is Louis Pasteur. Said, chance favors the prepared mind. You asked, how do I do a lot of things? Yeah, and I just yesterday spoke to a bunch of med students, a bunch of doctors, etc., and they asked, how did you sort of get there? And I'm like, the universe gives you lots of stuff, falls in your lap. It's up to you to be prepared to act on it. But a lot of where I've gotten has been like just chance. All of a sudden something happens, and to those who are wondering, can I do this, etc., make sure you're open to it, because a lot of stuff can fall your way. Listen, thanks a lot, Michael, and appreciate catching up today.
All right. Take care.